Hi, my name is Jacob Alatori. This is for the public speaking class for Greenwich. Just doing part of discussion 5 as to what topic I will be choosing. Um, the topic that interests me the most is the topic of healthcare, and yes, it is on a political stance, but it is the political stance for Medicare for all. The thing that really interests me the most about this topic is, as a nurse and as a patient advocate, you do see a lot of pretty much working around the insurance rather than the benefit of the patient. I have come in contact with, even working in a nursing home and rehab homes and also with family, that the insurances are pretty much, charging so much, giving so many fees for patients, premiums, co-pays, things like that, and yet their medical outcome is not benefiting them. The money they're putting towards private insurances, they're not getting pretty much the healthcare that they deserve. And I'm going through that right now with one of my fiance's family members. um, and it's very sad to see, especially as a nurse. um, the ideal audience of this topic is pretty much for those who don't know what really Medicare for all, what the benefits of Medicare for all are, and how it's going to be paid for. um, One thing that I know that Americans do not like doing is paying taxes. And Medicare for all, I think, is a gray um, area. And when you tell somebody about Medicare for all, I think the first thing that they come up with is new taxes. Oh, they're going to raise my taxes. And in a way, that's not really true, depending on who's doing it and who you're actually taxing. Um, but yeah, I would say the audience for this topic is for those who really don't know what Medicare for all is going to do and how it's going to be paid for. Because when you say it, I mean, government planned healthcare, not too many people are fond of that. So it's just pretty much a re-education of what Medicare for all really is. Um, I think people would find this topic very interesting because of how many people it would help. Um, we grow up in a time where, or we are in a time where things are really not the best. And I still feel that there are good in people and that we still want to help people to the best that we can. And one thing by doing that is making sure that I don't care who you are, if you're sick, you need help. No one should be denied the feeling of being healthy. I mean, that really shouldn't be something that is debated nor discussed. And I think people would find this really interesting as maybe an eye opener for them and maybe changing their views and being in support of Medicare for all.